Hi everyone, welcome back to Game Pharmacology. In this session, let us discuss a very important high-yield pharmacology Neet topic, that is therapeutic index. Myself, Dr. Padmanabha, TS. So what do you understand by a therapeutic index? So therapeutic index is represented by TI. TI. So what does therapeutic index states? So how it can be represented in the form of formula. So therapeutic index is a measure of safety. It is calculated based on the median lethal dose divided by median effective dose. Effective dose. So again, this can be represented as LD50, lethal dose in 50% of the population, divided by the effective dose in 50% of the population. So this is LD is taken whenever you are taking the preclinical experiments. So in animal studies, you're going to consider lethal dose, but in case of humans, you're going to calculate the toxic dose in 50% of the population divided by the effective dose in the 50% of the population. Is that clear? So whenever in your exams, if they ask, so what is the therapeutic index reflects about? So please remember the therapeutic index will going to reflect about the safety of a drug. Safety of a drug. It is the measure of safety. It is a measure of safety. It reflects the safety of a drug. So what do you understand by LD50? So let us make it clear again. So LD50 reflects about, it is the dose required in 50% of the population to experience the lethal effects, or if it in case of humans, it will be represented in the form of toxic effects. So what do you understand by ED50? ED50 will going to tell you about the dose required in 50% of the population to produce or to experience the desirable effects, or it can be said as a beneficial effect. Beneficial effects. So is that clear here again? So the LD50 will going to tell you about the dose which is required to produce the lethal effects or the toxic effects in the 50% of the population, whereas the ED50 will going to say you about the desirable effect or the beneficial effect that will going to produce in the 50% of the population. Is that clear? Okay. So how do you remember this therapeutic index formula easily? So it can be remembered as tile or it can be remembered as TITE. So how? TI stands for therapeutic index and L stands for the lethal dose in 50% of the population divided by the effective dose in the 50% of the population. So one more mnemonic is the TITE. So TI stands for therapeutic index and the T stands for the toxic dose in 50% of the population divided by the effective dose in the 50% of the population. So this you need to remember it. That is the tile and the tite. So we'll also remember the drugs under the low therapeutic index. So whenever we talk about the therapeutic index, since we are talking about the safety of a drug, so therapeutic index can be classified into low therapeutic index and the high therapeutic index. So those drugs which possess the low therapeutic index requires therapeutic drug monitoring, and those drugs which possess the high therapeutic index, they are much safer. Which does not require the therapeutic index. So it does not require the therapeutic drug monitoring. So only for the low therapeutic index drugs, you need to go for a frequent therapeutic drug monitorings. Is that clear? Okay. Next, we'll see the graph how to represent the therapeutic index. So this is the x-axis and this is the y-axis. So this is the graphical representation of the quantal effective curve. This is a representation of the quantal dose response curve, where the x-axis will tell you about the log of a drug concentration, and what about the y-axis? Y-axis will tell you about the percentage of the patients responding. So whenever you administer a drug, so initially what happens, this is the concentration x-axis, which tells you about the potency, whereas the y-axis will tells you about the response or the efficacy. So this graph, this is the minimal dose at which the drug is producing the effect. So this is producing the minimal desirable effect. So this is the efficacy. Or you can see it as a desirable response. On the other hand, please remember, when you increase the dose, what is happening? The graph is shifting towards the x-axis, towards the right hand side, and it is moving further. So what is happening here? The graph which is represented in the form of red color, this is the maximum dose which can be given. So above that, what will happen is, above this there is a toxic effect. If the dose is below this, there will be suboptimal response. You will get a suboptimal response. So the gap between these graph and these graph, the minimal dose at which it produces the desirable effect, and this is the maximal dose at which the patient can tolerate, above which there is a toxic effect. So this window is called as, this range or this gap is called as the therapeutic index. So this is the therapeutic index. So those drugs which are having a narrow therapeutic index, this drug range will be decrease. So this will become a narrow therapeutic index. narrow therapeutic index, and those drugs which are having wider therapeutic index, the gap will be more. The gap here will be the more, and they are much safer to use. Whereas since the gap has become very narrow, these kind of drugs have to go for frequent therapeutic drug monitoring. Otherwise, the patient will be experiencing a side effects more frequently. Is that clear? So this will tell you about this end will tell you about the toxic effects. Toxic effect. So here we are calculating what the therapeutic index. So what was the definition for a lethal dose or the toxic dose? It is the dose at which 50% of the population will have a toxic effect. So this is the 50% of the population where it is producing the toxic effect. So this is the lethal dose in 50% or toxic dose in 50%. So this graph will tell you about the dose at which the 50% of the population will produce the desirable response. So if you calculate the dose here, so let us calculate. In some of the exams they give a equation to calculate the therapeutic index. So what would be the therapeutic index here in this graph? So if you put the values here, so therapeutic index equal to therapeutic dose 50 by the median effective dose 50. So what is the values here? So here you have a 100 for therapeutic dose, the dose. So we have a 100 and divided by the ED50. ED50, here you can see ED50 dose 20. So let us write it. So what will be the therapeutic index here? The therapeutic index here is the 5, which is much safer. So they say that if the therapeutic index is less than 2, please remember therapeutic response is less than 2, you need to go for a therapeutic drug monitoring because this is of a narrow therapeutic index. So these kind of drug will have a narrow therapeutic index. Is that clear? Okay, fine. We'll moving on to the next graph. So please remember here again in your upcoming exams they can give a graph and they can ask you to identify what this represent about. So please remember here we are not calculating a 50% of the dose which is required to produce the effective response or the toxic response. Here again in this graph the x-axis is represented by the concentration of a drug in plasma and the y-axis is representing the percentage of the patient responding to it. The graph remains the same. So this range, so whatever the range, the steady state plasma concentration range at which the patient will have a maximum therapeutic benefit and the minimum adverse effects. So here you can see the patient is experiencing the minimum adverse effect within the steady state plasma concentration range, whereas the maximum they are getting the maximum beneficial response except for this area where the patient will have a smaller side effects, lesser side effects. So this range at which the patient will have, so this range at which the patient will have a maximum desirable effect. Desirable means the beneficial effect and the minimal toxic effect. So this is called the therapeutic window. So please remember this is the therapeutic window which tells you about the range of steady state plasma concentration. Please remember it tells you about this is the range of this will represent the range of steady state plasma concentration at which the patient will have a maximum desirable effect and the minimal toxic effect. So this line, the green one will represents the therapeutic response, and the red line, this will represents the toxic response. So please don't confuse it. If they give this graph and if they ask to identify this range representing the 50% of the population, it will tell you about the therapeutic index. It will give a equation for calculating a therapeutic index. Whereas if they ask about the graph consisting of a quantile dose response curve and they represent these graph and they show a maximal therapeutic benefit and the minimal toxic effect, then this will represent the therapeutic window, which represent the range of the steady state plasma concentration which is required to produce a maximal desirable effect with a minimal toxic effect. Is that clear? Okay, fine. So let us see what are the low therapeutic index. So low therapeutic index drugs can be remembered by a mnemonic. Please remember. So the mnemonic is like this. Warning, these drugs are lethal, Americans. So you are warning the Americans that these drugs are lethal. So warning, W stands for the warfarin, T stands for theophylline, D stands for digoxin, R stands for, you can remember as DIA. So anti-epileptic drugs, antidepressant drugs, and the antiarrhythmic drugs. So here anti-epileptics we have a phenytoin, antiarrhythmics you can go for quinine. All these drugs will fall under the low therapeutic index. Next we have a lethal stands for lithium and the American stands for aminoglycosides. So please remember the Americans, you are warning Americans regarding these drugs are lethal. Warning, these drugs are lethal. You are warning the Americans that these drugs are lethal. So let us solve some MCQs so that you can understand the concept clearly. So let us take up this therapeutic index. Therapeutic index is an assessment of. So what will the therapeutic index will tell you about? Does it tell you about potency of a drug? No. Does it tell you about the onset of a drug? No. Does it tell you about duration of the drug? No. So this is not the right answer. This is not the right answer. As we discussed earlier, it is a measure of safety. It is the measure of safety. The right answer will be the D. It is the measure of safety. So it tells you about the safety of a drug. So next, coming to the next MCQ, that is therapeutic index is represented by. So for this you need to remember the mnemonic, that is the either you remember tile or you remember tite. So therapeutic index is equal to lethal dose 50 divided by effective dose. So which is the right answer here? So this is the first one is the right answer, whereas the second option is the wrong answer, and third option is also wrong answer, and fourth option is also wrong answer. Is that clear? Always it is the LD50 divided by ED50. So next, coming to the next question, that is which one of the following drug has a narrow therapeutic index? So as we discussed earlier, you are giving the warning to the Americans. What warning you are giving? Warning, these drugs are lethal. These drugs are lethal. So propranolol is safer. It has got the wider therapeutic index. Even piroxicam has got wider therapeutic index. Prazosin has got a wider therapeutic index. So the only drug under these options which fits under narrow therapeutic range, which requires therapeutic drug monitoring, is the phenytoin, which is an anti-epileptic drug. So moving on to the next question, that is, which of the following drug needs the serum level monitoring? So as we discussed, the drug which are having narrow therapeutic index requires a therapeutic drug monitoring, which nothing but you are measuring the blood concentration so that the drug will remain in that therapeutic index range. So let us see the here what will be the answer. So please remember, here the answer is, it is not the lorazepam. Lorazepam has got wider therapeutic index. Haloperidol has got wider therapeutic index. Amitriptyline is also having wider therapeutic index compared to the lithium. So lithium has got the narrow therapeutic index, which requires serum level monitoring. So this is the right answer. Again, we discussed in the mnemonic. So you are giving warning to the Americans that these drugs are lethal. Lethal stands for the lithium. So one more way to remember these drugs is, so what was the formula we represented? So we represented in the form of tile, right? Tile. So T can be represented as theophylline. I can be represented as some of the immunomodulators like cyclosporin can have a narrow therapeutic index. What does L stands for? L stands for the lithium. What does E stands for? Epileptic drugs. And if you turn the E upwards, what will happen? It will become W. So warfarin. So if you are going to remember this style, you can remember the formula as well as the mnemonic. Is that clear? Okay, fine. Next, moving on to the very important thing, the antimicrobial drugs can also be classified based on the therapeutic index. So antimicrobials which are having a high therapeutic index can be represented in the form of formula PCM, and low therapeutic index can be represented in the form of mnemonic, that is the CAT, and very low therapeutic index in the form of PA. So P stands here, it is the penicillin. C stands for cephalosporins, and M stands for macrolides. So these are having high therapeutic index, whereas the CAT will have a low therapeutic index. So we have chloramphenicol, we have aminoglycosides, and we have a tetracyclines. And in the very low therapeutic index, we have a PA. So this is polymyxin B. A stands for amphotericin B, and a V stands for vancomycin. This you need to remember it. Is that clear? PCM, CAT, PA. So just to recapitulate, revise. So what was the therapeutic index? Therapeutic index is represented as a LD50 by the ED50. Please remember, therapeutic index is represented as the okay. Next, coming to the summary. So what does therapeutic index will tell you about? Therapeutic index will tell you about it is the ratio of LD50 divided by ED50. How we can remember? In the form of mnemonic tile. So TI equals to lethal dose 50 divided by effective dose 50, or it can be represented as TI equal to toxic dose 50 divided by effective dose 50. So what does the therapeutic window will say about? Therapeutic window is a range of steady state plasma concentration of a drug that will provide a therapeutic efficacy, maximum therapeutic efficacy with the minimal toxicity. And also remember, what is the mnemonic for low therapeutic index drugs? So you are warning the Americans that these drugs are lethal. Warning, these drugs are lethal. W stands for warfarin, T stands for theophylline, D stands for digoxin, A stands for antiarrhythmic drugs, anti-epileptic drugs, antidepressant drugs. And L stands for the lithium, A stands for aminoglycosides. Under the antimicrobials, you can classify based on therapeutic index like high therapeutic index examples are penicillin, cephalosporins and macrolides, and the low therapeutic index is GAT, that is the chloramphenicol, aminoglycoside and tetracycline, and the very low therapeutic index is polymyxin B and amphotericin B and the PARC, that is W or V, that is vancomycin. Hope this will help you in clearing the MCQs related to the therapeutic index as well as the therapeutic dose monitoring. Thank you.